Which treatments are most effective for Barrett's esophagus dysplasia? Imagine your esophagus as a tube that carries food from your mouth to your stomach. When acid reflux happens often, it can cause changes in the lining of this tube, called Barrett's esophagus. Sometimes, these changes can become precancerous, known as dysplasia. So, what are the best ways to treat this condition and prevent it from turning into cancer? Let's explore the options. The main goal of treatment is to remove or destroy the abnormal tissue and stop the progression to cancer. The most common and effective method for low-grade dysplasia is endoscopic ablation therapy. This uses heat energy to destroy the abnormal cells. The most widely used technique is radiofrequency ablation, which delivers controlled heat through a thin tube inserted into your esophagus. It usually takes about 1 to 2 sessions to treat the affected area, and the procedure lasts around 30 minutes. Patients often experience some mild discomfort afterward, but most can go home the same day. Studies show that radiofrequency ablation can completely eliminate dysplasia in up to 80% of cases and reduce the risk of developing esophageal cancer significantly. Another ablation method is cryoablation, which uses extreme cold to freeze and kill abnormal cells. It can be a good alternative for patients who do not tolerate heat-based treatments. Cryoablation is usually performed in a similar outpatient setting and may require fewer sessions. Both ablation techniques are generally safe, with minor risks like sore throat, chest pain, or temporary difficulty swallowing. For larger or more suspicious areas, endoscopic mucosal resection is often performed. This involves physically removing the abnormal tissue with a specialized tool. It allows doctors to examine the tissue under a microscope to check for signs of early cancer. After removing the abnormal tissue, doctors often follow up with radiofrequency ablation to treat any remaining Barrett's tissue. This combined approach can be very effective and may eliminate the need for more invasive surgery. In cases where dysplasia is not present or is very mild, careful monitoring with regular endoscopies is recommended. During these exams, doctors look for any signs of progression. Acid suppression with proton pump inhibitors is also important because reducing acid reflux helps protect the esophageal lining and may slow or prevent dysplasia from worsening. While these medications do not reverse Barrett's esophagus, they are a key part of long-term management. Surgery, such as esophagectomy, is usually reserved for severe cases where dysplasia has progressed to invasive cancer or when endoscopic treatments are not suitable. This involves removing part or all of the esophagus and reconnecting the digestive tract. Although effective, surgery has higher risks and longer recovery times, so it is generally a last resort. Overall, the most effective treatments for Barrett's esophagus dysplasia involve endoscopic procedures like radiofrequency ablation and mucosal resection. These methods are minimally invasive, have high success rates, and can greatly reduce the risk of cancer. Regular monitoring and managing acid reflux with medications are also essential parts of long-term health care. Staying vigilant with follow-up exams helps catch any changes early, making treatment more successful and keeping your esophagus healthy.